It's Palmdale Regional Medical Center's podcast series featuring our doctors and staff. Palmdale Regional Radio. Here's Melanie Cole.
There are many types of therapy that may help to reduce the swelling and discomfort of lymphedema for breast cancer patients. My guest to tell us about this today is Brandon Meister. He's a physical therapist and a lymphedema specialist with Palmdale Regional Medical Center. Brandon, I'm so glad to have you with us, as so many women experience that swelling and discomfort when they do develop lymphedema. Tell us what it is and where on the body does it typically occur?
Well, lymphedema is a protein-rich swelling that can occur typically in a single arm or leg. Most oftenly, we see it postoperatively in post-breast cancer mastectomy patients, but it really can occur anywhere on the body that's had any kind of surgical disruption or trauma disruption to the soft tissue.
So then why, if there's been surgical disruption, whether it's from breast cancer, surgery, or lymph node removal, what is the reason that this happens?
Well, directly underneath our skin is where our lymphatic system resides. It is a counterpoint to our normal vascular system and basically reabsorbs fluid, our white blood cells, cellular debris, and helps our body process it out and remove any sorts of contaminants or infection. And it basically sits between our outer dermal layers, which is our skin, and the deeper fascial and muscle layers underneath.
So does every woman that's had surgery or surgical interruption in that area get lymphedema? And are there certain people that are going to be at higher risk for it?
Not everybody gets it, but definitely anybody who's had surgery is going to be at risk for it. There is no rhyme or reason as to why some people develop it or others, but we do know, certain things are definitely going to increase your likelihood. If you've had surgery, if you've had radiation or lymph node removal, those definitely increase your likelihood.
Then are there some complications that can arise from this buildup of fluid?
We can definitely take steps to potentially prevent it, but there's no hard guarantee that it's not going to happen. Going into surgery, we want to make sure that we have as much range of motion as possible. That kind of stands true for anybody who's going into surgery, as well as keeping up our cardiovascular general health. That kind of helps keep our lymphatic system flowing, our normal circulatory patterns working. Preventatively wise, we don't expect or don't necessarily want to put anybody into like a compression garment to prevent it from happening, because that compression garment can also cut off blood flow and cause lymphedema.
Wow. And as I've seen so many women that really develop this, tell us about the treatments that you might use. What are some exercises that are important for lymphedema? What kind of treatment modalities do you use, Brandon?
Well, depending on the severity of the stage, there's two phases to the gold standard of lymphedema therapy is the intensive phase of therapy, which comprises compressive bandaging and lymphatic massage, followed by more of a maintenance phase and kind of general exercise phase. If we're in the initial stages or stage 0 or stage 1 of lymphedema, our swelling is very mild. You may not even be able to tell that you're swollen. It might just be a feeling of heaviness or tightness to the skin. In which case, with rest and elevation, the swelling goes down and it's not really apparent. When we get to more like the stage 1 to 2 or 3, we're looking at much larger volumes of fluid. You're able to easily tell just by looking at the arm. It's much larger than the other one, or much different shape because of where the fluid's retained. So in which case we're doing, lymphatic massage to the surface layers of the skin to increase the circulatory process, and then right afterwards we're wrapping for compression to help maintain that reduced volume. And then we're actually doing exercise once you're wrapped up. And that's really actually the most important phase of therapy, is getting you into compression and then performing light aerobic exercises to boost your circulatory process.
Tell us about those light aerobic exercises. Women have heard reach for recovery, but you're talking about a little bit more than that. Give us an example.
The reach for recovery and, the crawling up the wall, that's purely just a normal range of motion stretching that we do for any postoperative shoulder patient. For the circulatory process for a lymphatic patient, what we're really looking at is getting the muscle to pump. whether that's through an isometric contraction where you're just, squeezing a stress ball, or you're doing circular motions, or, cardio kickboxing kind of activities where you're moving your muscles, getting them to work. And it doesn't matter which direction you move it in, so long as your muscles are active.
True, that's really great information. So, what would you like women to know that may have been diagnosed with breast cancer, are expecting to go through surgery? What would you like them to know as we wrap up about lymphedema, about the therapy options that are available, and even possibly trying to prevent it in the first place?
I think the most important thing is to be self-aware. Pay attention to what your body is telling you. If it feels off, if it feels heavy, if it feels like it's getting tight, or if it's feeling stiff, the earlier you can get to intervention, the less likely that the problem's going to arise and impact your quality of life. And that's the big one. The earlier we can treat you, the less likely your life is going to be disrupted.
It's really great information and so important for women to hear that they don't have to suffer with the discomfort of the swelling that comes with lymphedema. Thank you for joining us. And that wraps up another episode of Palmdale Regional Radio with Palmdale Regional Medical Center. You can head on over to our website at palmdaleregional.com for more information and to get connected with one of our providers. If you found this podcast informative, please share on your social media. Share with other women that you know that might be going through this. That way we can all learn from the experts at Palmdale together, and don't miss all the other interesting podcasts in the Palmdale Library. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. Until next time, this is Melanie Cole.